Okay, welcome everyone. This is a meeting of the City of Northampton Board of Health. Today is March 19th, 2026. It is 5:31. Um, and before we open our meeting, we will have public comment session. Um, um, if there's anyone here who would like to speak in the public comment session, please raise your electronic hand. That should be a button down at the bottom of your Zoom usually. And for public comment, ground rules are that it will be for 2 minutes. Suzanne, are you up for timing?
Sure.
And when the time is up, you can finish your sentence or your thought, but then please stop. And this is not an interactive session. So this is public comment session where we would love to hear from you prior to the opening of our meeting. There's still more people coming in. Okay. Okay, I see two hands up, Ananda Lennox and Heather Warner. And Ananda, you can unmute, please.
All righty. Oops. Am I just going to stay off camera?
I think so. Yeah.
Okay, that's fine. I don't have to worry about how I look at all. Thanks for taking public comment. I couldn't make it to the other meeting. I just wanted to say, I have to admit, I'm not an expert on the nicotine-free generation policy, but I think that we have enough data now to show that nicotine is like a highly addictive substance and it really hasn't done anybody any good. And it's just getting repackaged in different formats. I do work in substance use prevention, and I have my son with me today. I'm going to share my 2 minutes with him because he just wanted to talk about what he sees in his schools, if that's okay. But yeah, I just wanted to give my 2 cents saying that I think that this is probably a good idea. I think the communities that are going with this are doing so with the best intentions of trying to protect their citizens. I know that there's going to be arguments about whether this policy will just make sales go elsewhere. But we know that the harder you make something that's bad for you to get, the more friction you increase. It does help dissuade people from doing so. I like the idea. Riley, are you ready to talk? I only have like a minute, so.
I don't know.
He can get his own time, even if you're sharing a Zoom. That's okay.
All right. Well, do you want to let Heather go and then I'll raise my hand again? Or,
If that's what you'd like.
I mean,
You
because he
can go
doesn't
now
have
if you want.
do you want to go now?
I don't know what to say.
You don't know what to say?
No.
That's fair. I guess this is just about the nicotine-free generation and whether you thought it was a good idea to try to get nicotine from being sold for future generations.
Yeah, that sounds good.
Okay. And can you just describe what you told me about like the vaping scene at the high school?
It's really bad. Um, and I don't remember what I said.
I don't know what you said either, but you were just saying like for something that's not supposed to be available to everybody, everybody seems to have it and it's happening in the high school all the time.
Yeah.
All right, sorry that I had to summarize, but but that's really all we have. So thank you. And I'll mute myself.
Thank you. Thank you. And actually, everybody, when before you speak, please say where you're from, your name and where you're from. Heather, you can unmute.
Hi, everybody. So my name's Heather Warner, she, her pronouns, and I live at 115 Pine Street in Florence. My kids went to school in the Northampton schools, and they are now young adults. And I work at the Collaborative for Educational Services in the Hampshire Franklin Tobacco Free Community Partnership. That probably took up my whole 2 minutes right there. Okay, so I know you had a forum. So mostly I just wanted to kind of hit on a couple of points. One is I know that people worry about retailer hardship. And I just want to say that when I have been in this industry of preventing nicotine harms for a very, very long time, decades. And when we first talked about having smoke-free restaurants and bars, everybody was very concerned about the impact. I think what happened is not only was there not an economic impact to businesses, but they actually ended up getting new customers because most people don't smoke. And so, and couldn't tolerate the smoky conditions. And so, that's one example. I think when Northampton was a leader in banning flavored products. I mean, that was we wondered was that going to be a huge hardship? And the truth is that a lot of the convenience stores are really smart and resilient. They understand how to adapt to a constantly changing new trends and markets. And this nicotine-free generation is actually a gradual increase, and I think would have much less impact than they might expect from the other things, which also didn't have a hugely negative impact. There was also the age 21 that we've adopted. So I think nicotine is sort of a thing whose time has come. Every time we, regulate one product, another one comes out, like the Juul and the vapes, and then now the nicotine pouches. And they continue to market to young people. Young people, in fact, say, when you talk about infringing on my rights, their rights are already being infringed upon by being marketed to in illegal ways. And then they become addicted and don't have that free choice anymore. So a lot of young people that I've talked to sort of turn that on its head and say, this actually, the freedom is already being taken away, right, when we become addicted at a young age. And thanks. So I really support the board in this, and thanks for giving me the chance to speak.
Thank you. Julie, you can unmute.
Thank you so much, Chair and Board. My name is Julie Nash, and I represent PMI US, which manufactures smoke-free FDA-authorized products. PMI US has only operated in the US for a few years. We do not sell combustible cigarettes. Our focus is exclusively on smoke-free nicotine alternatives for legal age adults. While no nicotine product is risk-free and nicotine is addictive, smoke-free products are less harmful than combustible cigarettes for adults who would otherwise continue to smoke. I could not be more proud of our innovative products and commitment to tobacco harm reduction. Today, I urge you to ground your decision in evidence-based science, specifically the FDA's science. FDA authorizes marketing of smoke-free products only after rigorous review of population-level risks and benefits. For example, the FDA has authorized 3 PMI US products, Zyn, IQOS, and General Snus, through the risk tobacco-related diseases to individual tobacco users and benefit the health of the population as a whole, taking into account both users of tobacco products and persons who do not currently use tobacco products, and a modified risk order for IQOS based on reduction in harmful and potentially harmful constituents when adults switch completely from cigarettes. The issue is very personal for me. My grandmother spent her final years on an oxygen tank after a lifetime of smoking. I don't come here lightly. I advocate for responsible smoke-free options precisely because they can help adult smokers move away from combustion. As you consider public policies that will impact both adults and youth, please use FDA-authorized science and expert consensus on the continuum of risk. As FDA has acknowledged, combusted or smoked tobacco products, such as cigarettes, are the most harmful type of tobacco product. Non-combusted products, such as e-cigarettes and other smokeless tobacco products, generally have a lower health risk than cigarettes and other combustible products. I'd like you to, before I close, and I have a few more things to say, but I know I only had a few minutes, so I'd just like to request, before you move forward, a couple of alternate routes. I think that if we sat down with our underage team, your local law enforcement, your public health staff, community advocates, we can get to a place where everybody wants to be. So I would advocate for increasing your tobacco framework for stronger age verification, retailer training and licensing conditions, sting operations and online enforcement, reasonable retail guardrails, and a carve-out for FDA-authorized smoke-free products. We all want youth tobacco and nicotine use to be zero, but I think if we work together, we can get there. Thank you.
Thank you. Habib, you can unmute.
Hi, my name is Hamid Habib. I am a store owner in city of Northampton. Um, I would like to say that we already, as far as youths are concerned, we already banned the flavored tobacco, which was a big attraction for the youth. We already raised the age to 21. Um, so being as store owner, I see that the youth has, you know, quite a bit gone away from smoking. Anybody who's 24 over is not youth anymore, and I believe they should have a choice of making their own decisions, either to smoke tobacco or not. Also, by putting this policy um, in effect, we will be pushing youth to go and smoke marijuana, because anybody who's 21 and over can walk to any dispensary, buy marijuana, and smoke that. Also, again, it is coming from a store owner, so it does affect your business. I know that is not the priority for the city, but in 5 to 10 years, if this policy goes in effect, you will see almost, if not all the stores, at least 80% of the stores closing down. Selling tobacco to adults is a big part of any convenience store's business. So I would suggest that, anybody 24 or older is not youth anymore. They should have a choice to whatever they like to smoke. Thank you.
Thank you. Ananda, did your son want to speak again? You can raise your hand if he wants to speak. There you go. Sure, you can unmute.
Okay, this is my second son. The problem though is he's not a public speaker and this is making him really uncomfortable. So can you just say your name?
I'm Lucas
What's your last name?
Gunderson.
What's your address? It's okay. It's just for public record. They know where you live
Green
anyhow.
Road,
Leeds.
Leeds.
Okay. Can you just tell them what you told me about like Northampton in general and teens?
There's a lot of smokers in the Northampton area, and there's also a lot of vapors in the bathrooms at Northampton High School. And at one point, I saw someone smoking, a teenager who went to Northampton High School smoking outside while entering the school. And I've seen a bunch of other times where people have been smoking and vaping while at Northampton High School.
Cool.
Thank you for letting us know. Thank you. Okay, is there anyone else here for public comment session? Please raise your electronic hand. Zach, you may unmute.
Hello, my name is Dr. Zachary Rich. I am a physician in Newton, Massachusetts that has adopted NFG. I make my living by treating tobacco-related diseases and people with nicotine use disorder. I encourage you to strongly support this NFG policy. I want to just take what time I have to address some of the previous speakers. Firstly, I do agree that non-combustible products could be a harm reduction approach for those that are currently smoking cigarettes, but I wanted to highlight that this policy would apply to people that are currently below the age of being able to purchase combustible products. Anyone who is currently smoking combustible or vaping will forever be able to continue to purchase those products. So when we say it's a harm reduction approach, that I don't agree with that. This is a you can't reduce no use at all. The other thing I wanted to make sure we address is nicotine addiction is by no means benign, even if it's without a combustible approach. I take care of patients that both use combustible cigarettes as well as nicotine vapes. And I think you'd be surprised that often those that are struggling the most with nicotine addiction are not those that are using combustible products, that people can have far worse signs of nicotine addiction from non-combustible products. These are not safe products that we want to keep them away from our kids. Lastly, the comment about being concerned about the economic impact of this, I think is misstated. If you look at Brookline, a municipality that has had this impact for the longest, not a single retailer has had to close in response to this policy. In fact, I would be very optimistic that, as we heard previously, this may overall be a benefit for economic activity, as people who would be previously spending money are now keeping that money in the community. Thank you for your time, and I encourage you to support the NFG policies.
Thank you so much. Is there anyone else here for public comment? If you want to speak at public comment, you'll have to go to the bottom of your Zoom screen and raise your electronic hand. Anybody else? Let's see. I don't see anyone. Okay, I think we'll move on. Thank you everyone who spoke. And thank you all for being here. So tonight, just to introduce everyone, this is the Northampton Board of Health. Our members tonight are myself, Joanne Levin, Chair, Dr. Cynthia Swopis. Where is everybody? Dr. Suzanne Smith and Janet Grant. So that we are a full complement of members tonight. We have Commissioner Meredith O'Leary. Commissioner O'Leary, would you introduce the other DHHS staff, please?
Absolutely. Tonight we have with us our Environmental Health Director, Amy Hutchins. We have our 3 wonderful public health nurses, and we have M. Moulton, Kelly Hughes, and Jennifer Denkevich. Yes, got that last name right. Thank you. Also with us tonight, we have Kristen Dearborn, who is our shared service coordinator, and we have Taylor, not McAndrew, it's now McDonough. Am I saying that properly? Recently just changed her name, who is the Director of Prevention. And lastly, we have Kelly Constantine, who is our admin staff. And I think that's it for DHHS.
Great, thank you. And so everyone knows that this recording is being, this meeting is being recorded. Let's, does any of the members want to make a motion to open the meeting?
Move to open the Board of Health meeting.
Second. Oh.
Any discussion? All in favor? Cynthia?
Yes.
Suzanne?
Yes.
Janet?
Yes.
Joanne? Yes. Okay, we are now in our Board of Health meeting. And first we have our lovely public health nurses to give us an annual report. Who's going to start?
Hello, good evening. I will go ahead and start us here. I'm just sharing our screen, the screen now. Can everybody see my screen?
Yes.
Okay, excellent. Let's see. Okay. Let me make sure it's nice and big. Moving some stuff around here. Okay.
I think you want to make it slideshow, yes?
Yes. Thank you. Okay. Did it work? Okay, perfect.
There you
Okay.
go.
Thank you. Good evening. My name is Kristen Dearborn. I am the Shared Services Coordinator for the City of Northampton, and I work for the Division of Public Health Excellence and the Hampshire Public Health Shared Services Collaborative, um, which Northampton is the host of the Public Health Excellence or PHE grant that supports the Hampshire Public Health Shared Services Collaborative or HPHSSC. And this is a partnership that strengthens public health capacity across the region. And so you'll see here the report for Northampton, we've also done for our 14 towns in the HPHSSC. And our services range from inspectional to public health nursing. And we're really lucky to have our public health nursing team here tonight. As part of our work, we support infectious disease surveillance and reporting throughout the 14 communities using Maven. Local and regional public health nurses work together to monitor reportable diseases, conduct case investigations, and help protect the health of the community. So my role involves helping to support shared staff like the nurses with project and program coordination. And in this project, I helped the PHN, the public health nursing team, assess disease trends in our region using calculations for incidence rate and looking at these trends over time. And just for your context, when viewing the report, incidence rates were calculated using case count divided by the total population multiplied by 100,000, which is the standard, and the multiplier of 100,000 allows for meaningful comparisons across populations of different sizes. And also another note is for confidentiality purposes, case counts between 0 and 4 are suppressed and displayed as being less than 5. We included some really great illustrative visuals in the data report, and the nurses can speak to all of the disease surveillance and case investigation those numbers represent, and the upstream approach to prevention that is the heart of public health nursing. So without further ado, I will move to the next slide. Oh.
Good evening, everybody. My name is Jennifer Dinkevitz, and I'm going to provide a snapshot of information on respiratory illness data taken from the 2025 City of Northampton Infectious Disease Annual Report. Influenza cases, case counts surged significantly during this respiratory illness season, both locally and nationwide. It exceeded COVID-19 case counts. Vaccines continue to be one of our best ways to prevent serious illness from influenza and COVID-19. Current as of January 2026, the city's vaccination rate for flu was 47.30%, and that was higher than the state of Massachusetts average of 35.80%. This may have contributed to less severe illness and 0 reported pediatric deaths in our community. Our public health team administered vaccines at 15 specially organized clinics across Northampton and Florence, and that was to meet the needs of the community. At this time, I would like to segue into our vector-borne disease slide, and presenting that is my teammate, public health nurse, M. Moulton.
Hi, everybody. Good evening. Here we are discussing the vector-borne diseases, most notably very high incidence of Lyme disease in Northampton. And this captures new and possibly old infections. However, it does mirror the trend in the state in general. Lyme disease cases have risen across the state. One factor contributing to this rise in Lyme disease cases is climate change. Interestingly enough, because I'm a huge tick nerd, it's not necessarily cold winters that just impact tick populations, but also humid springs. So due to climate change, we've experienced higher temps and humidity and humid springs. Mass DPH hosts an annual arbovirus report update, and this will be in June 2026. And in that annual update report, they will showcase the vector-borne disease data from the 2025 season. We had no cases of triple E or West Nile virus in Northampton. Some mosquito samples did test positive for these diseases in Hampshire County. Northampton is very proactive. Northampton is a member of the Pioneer Valley Mosquito Control District, which focuses on prevention and mitigation of mosquito-borne diseases and targeted treatment of mosquito catchment areas. For more information on the Pioneer Valley Mosquito Control District, please visit our local webpage. Thank you.
Okay, I think that we're going to move on. You're all done. We're going to move on to GI, gastrointestinal illness outlook for Northampton. So if you can see, the illnesses shown here on the slide are basically considered self-limiting. I think we have norovirus, Campylobacter, and Salmonella. So what that means is that most of the people who are infected this will recover in about a week or so, and also probably without the need for antibiotics, so they may not even seek medical care. So as a result, these data reflect only laboratory confirmed cases among individuals who presented for care and were offered testing. So while the numbers do not capture the full scope of illness in the community, they're still valuable tool for identifying trends and shifts in seasonality and broader patterns. For example, if we see that bold blue line is an increase in norovirus cases shown that's consistent with national trends, including higher overall prevalence and changes in the typical seasonal patterns with norovirus. So I don't know if you remember last Board of Health meeting, M had sort of noted that the Mass DPH no longer recommends routine investigation of individual norovirus cases among people aged 12 to 79. And that policy change reflects the significant rise of norovirus cases, the volume over the past 3 years. So we do still investigate individuals under 12 and 80 plus, because those are our most vulnerable. But as norovirus is endemic and very prevalent, it's not anything that we are individually tracking. So I think that the biggest thing to think about here is we're looking at trends and seasonality, but also the idea that surveillance is not just about case counts. Case counts are important, but looking for trends, looking for emerging things such as H5N1 and what that may do, measles, what's coming our way possibly, and then sort of this informs our messaging and our outreach, and certainly our infection control communications with our community stakeholders, schools, daycares, hospitals, that kind of thing. So numbers are great, and they certainly can paint a picture here. But I think in general, looking especially for something like norovirus or some of these things, there may have, it says this past year rather, there was no salmonella. That's not necessarily the case. It was just, we did not have one lab confirmed salmonella in Northampton. So I think that's all I have for GI. And I think, Kristen, you were going to wrap everything up, right?
Yes, thank you. Thank you so much to our public health nurses for presenting that. And I'm just going to share some final thoughts for the board. It was great to see you all on Saturday at the Health Board Association meeting. And I just wanted to share that the regional team is currently working on the SAFE 2.0 Performance Standards Survey administered by the Office of Local Regional Health, and that is due April 30th. So we invite members of the board to attend our Public Health Excellence meeting for HPH SSC, and I can send you the link for that. That is on Thursday, April 2nd. And I'm also happy to attend any future meetings to help answer some questions about that and connect with our partners and resources at the state level who can also speak to those performance standards. And that's all that I have. So thank you very much. I'll stop sharing my screen now.
Thank you. I do have a question. Kelly, do you think that the big increase in norovirus may have anything to do with testing? Because normally at least in the past, that was not something that was routinely tested for, or a whole lot of testing wasn't done for that. And I'm wondering if that some increased testing has anything to do with that big jump. Any clues
Yeah,
about that?
I think that that's definitely a factor, but we were seeing a lot of false positives due to some lab processing. So when we were investigating, we were calling and determining whether it was an acute, active infection, and then we would send that back and hopefully it would be revoked in the system. But I think you're right. The more people pursuing testing, the more docs ordering, a stool study, the more likely with anything you're going to see positives. But looking at national trends and reading the things that all of the lovely infectious disease docs and epidemiologists put out there, norovirus has had a significant surge. And also the seasonality that we used to see is sort of shifting, and it's no longer, the traditional times that we were seeing it. So that's definitely a factor. But it also is becoming more prevalent. If you look at the trend over the last 3 years, I don't think we had that slide, but on Mass DPH, they do have a great report where they show the illustration of cases and they list out. So over the last handful of years, there's been significant increase, and that's also due to infection, not just positive tests. I think they're looking at other things too.
Thank you. Anybody else have questions? Cynthia?
Yeah, two questions and a comment. In the full report, I noticed the shared services data was in there, and that was simply amazing. So I want to thank you for showing that to us. It's very interesting to compare the cities and the towns. Appreciate it. I was wondering about schools and kids. Can we do the wide lens? Do we have access to that? Do we track that? How kids are experiencing RSV norovirus? As I understand, there was a lot of sickness in the schools. I know we have sort of a separate group, right, Meredith, that does school stuff with our kids, but do we track that at all?
Kristen
Do
or
any of
Meredith?
the nurses want to answer that? I mean, we track it the same way we do with adults, and Maven doesn't, there's no age limit on what comes in through laboratory testing, so it would be the same information. I don't know if any of the nurses have, NPS district school data on whether or not there was an increase of respiratory illness.
At this time, I do not have that. I do not have that information, but I'm happy to try to obtain that for everybody. I do often communicate with the school nurses. They will give our public health nurses calls when they have questions about respiratory illness, noroviruses. And actually, this past month, we actually did add some information because we saw that the trend was increasing, and placed some information on the superintendent's letter to go out to parents and teachers and staff, just to give everybody some more knowledge about what might be to come. So, and they are very much encouraged to, we also provided the public health nurses information in case there were community questions, and hoping to assist in that. I think, Cynthia, also the schools as well as the long-term care facilities, they are required to report clusters. So there is an online form that the tool that they use that automatically draws that information and puts it into Maven. So the state is aware of it, and then it also gets kicked back to us. So we follow up more on like infection control mitigation strategies, just managing the cluster, and then the state EPIs are managing the data for that. And I unfortunately can't speak to how those numbers get factored in, but it does get entered in as long as they're reported. Same thing with respiratory illness. GI illness and respiratory are reported through self-reported through the schools and the facilities.
Thanks, Jennifer. Thank you, Kelly. And then my final question is, what's the recommendation this year for COVID? Is it a one-shot, one and done, or is it a two-shot, depending on your age, or are we still sifting through all that?
As far as I know, there have been no new recommendations in my mind, not from anyone that we can depend on. And it's still sort of for people at higher risk, 65 and older, there's sort of a loose recommendation, not based on a whole lot of science, is maybe 2 per year because immunity significantly wanes after about 4 months. So if you do them 6 months apart, that helps you out. We do reliably have surges in COVID-19 during the holidays, so the end of December, and then usually a big surge in the summer, and no one knows sort of why that is. We don't know a whole lot of things about COVID-19, but so if people at higher risk are trying to decrease their risk in anticipation of those surges, might think about doing it getting a vaccine 2 to 4 weeks before those anticipated surges. Suzanne,
even though
question?
you're retired, Dr. Levin, I'm glad to see that you're right on top of it. Thank you so much. Thank you.
I wanted to comment about the impressive immunization performance. That was quite remarkable. This was a year when, viral illness was not in the headlines every day. I recall that there was flu that was around, but it wasn't a news item that I'm aware of. And yet, I was really amazed at the number of injections that you were able to give. I have a question about the this is actually an item from our minutes, which is not fair to you, but it talks about learning in January that there were 34 sites and over 1,600 total vaccine doses given. Were those 34 sites all within Northampton, and were those all given within Northampton?
I can speak to that. The 34 sites were a combination of Northampton and the other communities. Strictly Northampton was the 5 clinics between Northampton and Florence, if that helps.
Yeah, thanks.
You're welcome.
Any other questions for Kristen or the nurses? Beautiful presentation. Thank you so much. Always appreciate your work.
Thank you.
Okay. Great. We'll move on to our discussions and updates. And first, about the nicotine-free generation policy. I think it was Cynthia who made a nice little review of the comments that were made at the last at the forum. Thank you, Cynthia. And does anybody have any comments? Anything else you want to say about that policy or how you want to move forward?
Joanne, may I just, for those who might not have been at the forum, just announce publicly that on March 5th of this year, the Board of Health hosted a public forum, which is an open dialogue about nicotine-free generation policy. The forum was widely advertised by the Department of Health and Human Services through social media, press releases, personal invitations to local businesses, anyone that could have been affected if this policy is adopted. So our department did a really good job doing that. During the range of the forum, we had a range of perspectives, including from those who support the policy, those who have concerns, and we even had a few youth participants from communities that have already adopted this regulation, who shared their experiences and why they support this strategy, which was super cool and empowering. So I just kind of wanted to lay that framework out for those who might have not known or missed the forum. So today, the board is going to discuss, like Joanne said, Cynthia did a nice job putting together some notes from the forum, and the board is going to discuss how they want to move forward and or what they heard at the forum.
Any comments
Does that mean
to start?
we're discussing and voting tonight?
No, I don't think there's a plan for a vote. I mean, anybody can make a, you know, a motion at any time, but I think the plan had been that we would just talk about how, if and how we want to move forward and what that might look like. I mean, if we wanted to adopt the nicotine-free generation, it would mean changing one line of our current policy. The current policy says only people 21 and over, stores can only sell to people 21 and over, and that line would change, and we'd have to like pick a date if we wanted to present a proposal. And then if we wanted to go that route, we would pick a date, sort of have that new format, and then have a hearing. Next time would be a hearing, and then a potential vote. So unless someone wants to make that motion, I hadn't planned on having a vote tonight, just really a discussion of if and how to move forward. Any
What would the
thoughts?
hearing, what's the hearing, how is that different than anything we've already done?
Well, a forum is a more relaxed, informal discussion. That's what we had last time. A hearing is a formality where you hear people. It's similar to public comment. There's no discussion. It's a very particular kind of forum, and it's sort of thought to be best practice before adopting any new regulation to do a forum. It's not required for anything except septic, like Title V hearings, changes, but it's thought to be best practice. And so we've had a lot of public comment already, but that would just be one more opportunity. So does anyone want to speak up of how you want to move forward or not?
May I say something about some of the comments? A number of them were directed towards issues with convenience stores and other places that sell tobacco. As I think about this, I wouldn't expect convenience stores to close or there to be any current effect on their sales, except for people who turn 21 each day, because at that point they become eligible to buy cigarettes. So I don't know how many people in Northampton become 21 each day, but that's, I don't expect that to be in the hundreds. So we're talking about a potential market, not the current market. The current market consists of people who are 21 and older who can buy nicotine products. But the regulation would only affect those who are coming forward and are potential customers. So I think thinking of it that way, I don't expect a big hit to sales. That would require people who are currently able to buy cigarettes to stop buying. And this NFG has nothing to do with that group. So I've had to think this through about the year of birth and how that affects sales going forward. And that's what I come up with. I may be wrong about that, but that's how I've thought it through.
Well, if it's preventing new people from coming up, you also have to think about the current users are dying little by little. So the goal really is eventually that there will be very few smokers, right?
That would be that's a long-term goal.
Very long. Yeah. I also want to say something about NFG so a lot of people in the public health arena are talking about high schoolers, right, who are underage and who are still getting nicotine and tobacco. I think part of the beauty of NFG is that it changes the peer group. So like in college, you have some seniors who are over 21, right? But some of the freshmen are 18 or so, right? They still have a peer group of people who smoke who can legally obtain. But with NFG over time, that group is no longer going to be able to buy legally. So then you don't have peer groups buying for the, older folks buying for the younger folks. And I think that's part of the beauty of this policy, in addition to being a very gradual one. I did want to bring up the question. Once one person spoke about smoke-free nicotine for adults, FDA approved. I just want to bring up that I want to make sure that we're correct about this, that people can still get products for cessation based on their age through the NFG, but also by prescription, right? There are prescription products for smoking cessation, right?
They're also over the counter.
What's that?
They're over the counter.
They're all over the counter?
They're nicotine products, nicotine reduction products are now available over the counter, have been. I don't know if prescription affects the willingness of insurance to pay for it or not, but it is available. It's expensive. Not that cigarettes aren't, but it's available.
So I'm just wondering if there are people. Go ahead.
No, that won't. I don't think this will affect that at all. The availability will be the same as it is now.
How is that? The age of availability would change with the NFG, right?
Yes, only I thought we were talking about currently. You're talking about going forward. Yeah, each day people would not be, that's an interesting issue about whether people should be eligible for nicotine stopping products that are available over the counter. That it has a different purpose. I don't think it has the same effect that nicotine itself does. Certainly the new products that have a highly concentrated amount of nicotine are not comparable in any way to nicotine gum. But that will still be available. I don't think there's anything we can do about that unless we want to tackle that. I think that would be counterproductive.
Joanne, is the question, will nicotine cessation products be available to those who fall under the NFG age, right? So you're over 21, but you can't buy because of the date of birth. So we do have two of our nurses did take the tobacco treatment specialist training. I don't know if that is something they could answer, but I don't believe they ask for an ID when you're buying a nicotine cessation product.
And are those products very different and separate from all other nicotine products, like, the ones the kids would like, or the
the vaping ones, the vapes that are, were originally, I think, manufactured for cessation and can help people cut down on using the combustible products. But according to what we've heard many times, I think now with the data from the Spiffy Coalition, it increases rates of youth use. It's the same product.
Nicotine gum has a much slower release.
I'm not talking about gum. I'm talking about the vaping, the products.
I understand.
Yeah. Okay.
I'm sorry. I was moving on to it.
Okay.
I agree with you that one of the original pitches for the vaping was that they could be used for harm reduction. And I think we do have enough data to show that they're problematic in their own, and we've been addressing vaping all along. But I thought Joanne had asked about mechanism of action of the nicotine cessation products, and they are slower acting. They do not get the level of nicotine in the system that the that the hit you get from these other products, especially the new ones that are much higher concentration, the cessation products can't compare to that.
But I think they would fall under the NFG rules as well. So if you had, in a few years, if you had, if the 25 and under crowd could not access nicotine because of the NFG, but you have people under that age that are addicted that wanted to quit and use the cessation products, they wouldn't be able to access them.
Well, I would hope we could consider that. That's a specialized product that's made by pharmaceutical companies in measured doses and is for the purpose of cessation.
I just would add, I'm sorry.
Go
I
ahead,
think
Sam.
to
Yeah.
my understanding, what I recall from my training was that those products, and now this is just for 18 and under, are not FDA approved for the use in under 18 and under. However, pediatricians, through counseling can, use them off label. So as far as like whether or not they're going to be ID'd at CVS if they try to purchase, a lozenge or something like that, I think technically they're not allowed to sell to underneath, but I don't know that that's anything that's enforced or, I mean, maybe Amy and some of the inspectors might know more about that, what they do as far as looking at establishments that sell the cessation products. But if you're going by whether or not the product's approved for the use of minors, technically they're not, but they are prescribed off label. So in which case, I imagine that the pediatrician could give a prescription for a lozenge, and they actually have found that those are the most effective tools for helping youth quit. So we certainly wouldn't want to have those, there be a barrier to them getting those products. If that makes sense, I don't know if that's helpful.
I'm just going to interrupt for 1 second and just say to the public, including Dr. Rich, that we are in public, in our public health meeting, and we are not supposed to engage with the public at this point. So this is a meeting that the public can witness, but we're not engaging. And I know we have some questions, and we're going to have to get some answers. It may happen after this meeting. Go ahead, Cynthia.
Yeah, regarding cessation, I mean, I think we need to remember that Meredith, I think it was you, someone sent the article that showed Massachusetts has dropped significantly in its approach to tobacco for one reason, cessation. That our whole cessation program fell apart and Janet, you remember how much money there was in tobacco control. And when I used to be running the grant in Northampton, I would have all these cessation meetings all over the city paid for anyone to come and to try to quit smoking. Okay. And so we don't have that anymore. And so maybe as we consider this, where are the gaps in cessation? And if there's any funding or whatever, and I'm so happy to hear that Kelly and the nurses are trained in this area. So we might want to just think, right, about how we can, if we were to go in this direction, realize that cessation still is tough. In terms of whether it be hypnosis or medication and the cost of it, purchasing. It might be something that we want to tackle. I'm not saying it's a reason not to do it or to do it, but I just don't want to forget about that the resources are just simply not as available as they used to be.
I'm happy that you brought that up, Cynthia, because we are actually tackling that here in Northampton. Sandra Mandel, who's an MSW, is joining our team through the Senior Tax Write-Off Program to facilitate a 6-week tobacco nicotine cessation group for adults living in Northampton. And she's working with our public health nurses. And she, I think maybe my nurses can help me fill me in, but anyways, she's bringing, her extensive expertise, the training that she received at Rutgers Tobacco Dependence Program, Center for Tobacco Studies, and the Center for Tobacco Treatment Research, and wrapping up this wonderful cessation program, and the nurses are helping to complement this work, advertise the work, and learn from each other. So I do believe that's going to launch in September of this coming year. And hopefully we'll have more of that to offer. So it's kind of like our pilot that we're doing. We know it's needed. We know we need youth cessation programs as well. So the nurses and myself and Amy are talking about that and what that could look like. Super important, right? If we have these really strong policies that we're able to support the people when they're ready to quit or want to quit. And we're naive to think, and we've heard from Ananda's young kids, like just because they can't legally buy it, the youth are getting it and they are addicted to it. So yeah.
Yeah, that is great news, Meredith. I love to hear that. And for those of you that don't know, our bathrooms in the high school are closed. Kids cannot use the bathroom for a combination of vandalism and vaping. And so the more we can help our kids get through this, the better off we're all going to be. So that's great news.
Mhm.
Kelly, do you know if cessation products are available only over the counter, or are they also available by prescription? Or Suzanne?
They're available by prescription as well.
They are. So
Yes.
I want to make sure that they are available if someone needs them.
Yeah, and I
Yes.
think it's also you have a combination of using products, medications like Wellbutrin, so things that you definitely need a prescription for, and then things that are both prescribed and available over the counter. And then, of course, cognitive behavioral therapy, groups, those sorts of things are, using in conjunction are the most effective. So having all those accessible is really important to people.
Thank you. Janet?
I guess with everything I'm hearing, I just feel like in general, I feel like there's little that we have left to discuss. I understand the idea of the hearing. It sounds like we do need to kind of figure out this one piece in terms of initially, older people who use any kind of nicotine products are going to be able to also get, if they want to quit, use any of the products that we've talked about that could help them quit. It's when those people, based on birth date, and might still have taken up the addiction and they want to quit, that can become an issue. So it sounds, and I know is it Dr. Rich, I think? I'm not sure if that's his first or last name, but he probably has some information. We can probably get some other information to address that one thing, which is important in terms of people who currently smoke. But I think we have a good sense, at least I feel I do, about the overall use of this policy as a very strong public health practice to start having young people have less and less and less access while still protecting retailers from having this drop in sales immediately. And I've just seen so much data at this point. I think the Spiffy Coalition has done this great job in addressing it. I'm not sure if it was them who put together the fact sheet that we got that addresses a lot of the questions that and the concerns that are asked over and over again. So that's all to say that I'd like to see us move in as quickly. I mean, not to rush it, but I feel like we have spent a long time on this and given people many, many opportunities to speak about it and considered many, many things. And I just feel like we should now take whatever final steps we need to take. Getting those questions answered, and then having the hearing and finding out when can we then vote on this policy so that we can really, look at what date makes sense if that's the direction we're going to move in.
Great. Anyone else want to talk about how you see us moving forward?
Can I just add, like on the inspector's side, just a little bit, and I can, certainly get more info. So I don't know when, but nicotine products have been taken out of the pharmacies. So when they are like CVS, Walgreens, things like that. So when they are in there inspecting based on food products and things like that, they're not looking at cessation. So I'm assuming that's where those products are. So I really can't speak to how a pharmacy ensures that their over-the-counter products are being sold.
Yeah, I think we'll have to just look into that.
We may be able to get some guidance from others who have already passed nicotine-free generation for their localities, their municipalities. I don't know if anyone has spoken about that to date. I just don't. It just instinctively that doesn't feel like the core of the problem that we're trying to address is nicotine cessation products sold over the counter in pharmacies.
I just want to make sure we don't throw out the baby with the bathwater kind of thing when we do this. But if products are available by prescription instead of over the counter, then that sort of solves that one right there. Janet?
I just also wanted to mention, I think the thing that I really like most about this is helpful to the retailers in that once a date is decided, it's one date, and all their various clerks and people who come in and need to be trained and then need to figure out, well, I know they have ways, to quickly look at the new date, but I just feel like it's going to make life easier and more simple in terms of the retail sales.
As far as changing the status of the availability of cessation products, they were made over the counter to address the barriers that were created if they were only available by prescription. I don't know how often you can get in to see your primary care, but every 3 years. I'm kidding, but it's very difficult to make a visit for that. And at the moment that person wants to quit and wants a tool to help quit, and the accessibility should be there for them.
I'm getting a lot of texts from our colleagues in the DHHS and subject matter experts saying that the FDA approved cessation products are not don't fall under the same category as the recreational nicotine products. So even if we move forward and pass the NFG regulation, those that have the birth date or fall within that birth date and aren't able to buy the recreational nicotine or tobacco products can still buy the FDA approved tobacco cessation products that are typically sold at the pharmacy. Taylor's nodding.
Yeah,
which is Cynthia, as Cynthia pointed out, where the nicotine cessation products are sold is a different place than where the products are that being sold that we're concerned about.
Yeah, yes, that's my understanding and what Meredith shared as well. So I think, what I heard, and I'm thinking of Kara and, there could be a small population of young people who have already developed an addiction who are going to need cessation products. Those will still be available either by prescription or
like was just mentioned, over the counter without prescription for those who cannot, get access to their doctor. And so the NFG policy at its core is not to restrict any access to FDA approved cessation, but only commercially produced nicotine and tobacco products. So thanks, Meredith, for chiming in. That felt important to name because, that's certainly not at the mission of this policy. The two go hand in hand.
Thank you. That's really helpful. So let's make the assumption that cessation products would still be available if NFG was adopted, and between this meeting and the next, we can verify that. How would you like to proceed? We would need to pick, if you want to move forward with that proposal, we would have a hearing and vote on it next meeting. We would need to decide on what the birth date is. Say from this date, you'd have to be born before this date in order to buy.
Yeah, it's unfortunate that we've taken this long and we've missed the January 1st, which would have been much cleaner, but we are where we are. But I'm not making a motion here, but I'm just suggesting for next steps that we wrap this up in our April meeting after the hearing. And if we want to think about that date now and talk about it, or talk about it when we make the change to the policy.
I think it would be nice to pick a date now so that it could be presented as the policy we're voting on.
Yeah.
Any thoughts about how to do that?
But I thought that we were talking about a year, not a date.
No, it's a date.
The
Well, because if you wanted to go into effect next January for the year, then there's a long time until that would go into effect.
or we just implement it now for a partial year. I mean, understanding that there hasn't been 12 months of notice given for this policy, 9 months instead. We can make it this year.
Well, the problem with that is what we've said all along is that we're not taking away anyone's right. And so people who turned 21 between January 1st and now
You're right.
have already had the right. So we can pick a future date like June 1st or July 1st is exactly mid-year. It's awkward not to have a January 1st date, but it gets it done. So thoughts?
Yeah, I mean, we're stuck, it's going to be a little complicated doing June 1. I don't know how inspectors feel about that.
Do we have other models of when it happened not at the January 1st? Because there's been a lot of communities now that have implemented it.
The ones that I've seen have done January 1st, but I haven't seen them all.
I don't, I think I remember we listed at one of our meetings, we've been talking about this for a year and a half, so it's not going to come to any surprise to any vendor if we do pass it. But I think we listed out, and there might not have been 21 communities at this meeting, but the communities that did pass it, I want to say it was kind of split, 50% passed it, the effective date being a January 1st, and the other 50% didn't. So it was a little across the board. I think for me and the inspectors personally, I run by two types of years, and one could be the calendar year, and then there's my fiscal year. So if it's not January 1st, like July 1st would be the next kind of logical date for me and my mind. But I think picking out a date today, if the board's going to make a motion to have a hearing, to take, to have a draft regulation to propose this, having a date for that draft regulation, would be great. And because I'd like to circulate that to our vendors as well.
I don't see any date that's better than than July 1st, that's easier
Yeah.
to implement than July 1st.
Yeah, I don't think it's any more or less complicated for the inspectors. And maybe, yeah.
And again, for the public, I'm sorry, this is not we've passed our public comment session, and that we're now in the board meeting. Taylor?
Just as a local example, Conway in Franklin County has May 12th. So
Interesting.
mhm.
Day. I like that day.
Okay, would someone like to make a motion or just a more general proposal that we do what?
I'll try a motion or whatever we want to call it, but I move to have a public hearing on the tobacco-free generation policy at our April meeting, and at which time we will continue discussion and vote.
I will
With-
not be here for the April meeting, just to let you know. Sorry.
So we won't have well, we'll still have a quorum.
You have a
Will we?
quorum. You have a quorum.
I'm going to put that in my motion, Suzanne.
Do you want to, does anyone want to make a friendly amendment about a date that we might choose to put in that proposed policy?
Well, I'm wondering, I know I'm trying to move it, but I can't say exactly why, but I have a bias that we try to do it at the start of the calendar year, even though I know that we're losing a lot there. I mean, there's a loss either way in my mind. But I'm wondering if, given that we're going to have a hearing, that it might just give us a little bit more information to help. I mean, could we have two potential dates going into this next meeting, the July one or the January one, and make that as part of, the overall decision during the discussion?
We've put a lot of effort into the program that restricts the sale, and we've had problems enough with the vendors adhering to the day and the year. I think this should be as easy as possible. I think going forward, it will be difficult to implement those who are born after July 1st, 2026, or cannot buy cigarettes. It's different than what they are used to.
So by the way, it wouldn't be 2026. It would be
20, 21 years from 26. 05, yeah, that one. But I just think that implementation, we're changing something that people are used to doing, that we've had a difficult time training people up to be able to perform to our satisfaction. And I think we need to make that as smooth as possible for people who have to do that.
Actually, the stores have some kind of, Janet referred to some kind of little mechanism that helps them, figure out birth dates. They could probably just get another new little mechanism that tells them, what if a birth date is before or after this number. So I don't think, personally, I don't think it's that much of a hardship to do it mid-year. I think most people can tell what months are before July and what months are after July. So I don't think that's a huge hardship.
Yeah, I'm still, I think when we've had problems with retailers, it wasn't because of dates and years. It was because of a lack of training of staff. And I just feel that it's unfortunate. We can't do it January 1, but I don't know, taxes are due April 15th. What's up with that? So I just, I prefer, I don't want to be a dissenter totally, but I would just prefer going with the July date.
So I think we have a consensus that we want to move forward with a hearing. So we actually have a proposal on the table, a motion on the table. Was there any further discussion about the motion?
I just want to say that I'm not opposed to the July date. I'm not opposed at all. I'm just bringing up some potential issues.
Okay,
And
so we need to vote on the motion.
does not include a date.
Okay, right. So the motion was to have a public hearing on the nicotine-free generation policy, at which time we will, after which time we will have a vote, and that should be at the April meeting. Any other discussion about this motion?
I second it.
Oh, yes, thank you for seconding. Any other discussion? All in favor? Cynthia?
Yes.
Suzanne?
Yes.
Janet?
Yes.
Joanne? Yes. Okay, so that's our plan. We don't have a motion about a proposed date, but there's obviously been some discussion. Does anyone want to make a proposal, or you want to leave it as is?
I think if we don't decide on a date today, we're just delaying this decision even further. I propose that we choose July 1st as the date.
A second.
Do you want to choose a year? I think it's 2005.
Right.
Mary, is that right? It'll be 2005?
Right.
Okay, there's a motion on the table to choose the date for NFG to be July 1st, 2005. Is there a second?
I seconded.
Any discussion?
I guess, I'm certainly willing to go along with it because overall, I believe this is the right way to go for the young people in Northampton and as they get older for the entire community of Northampton. I wish it could be, on that January 1, but I'm not going to hold it up for that. So.
Any other discussion? All in favor? Cynthia?
Yes.
Suzanne?
Yes.
Janet?
Yes.
Joanne? Yes. Okay, that's the plan, to have a hearing and a vote on the NFG proposal, which would include a date of July 1st, 2005. Thank you, everyone.
Great.
And I think in the meantime, Meredith and maybe Taylor, can we just verify that those products will be available, and whether it's in a pharmacy or whether we need a prescription or whether it's over the counter, exactly what would be available to people who might fall under the NFG age if they have an addiction? Can we just verify that information? That would be great. Thank you.
Absolutely.
Okay. Next up, Meredith, do you want to give us some updates?
Sure. The next agenda item is future Board of Health meetings. So I don't know if you want to talk about that or not, but our next one is April 16th. And so Suzanne said she's not going to be here. We're going to have our hearing on that date. We'll need all three of the other board members present to have the meeting. So if anything comes up prior to, just let me know so I can reschedule that.
Hopefully it's not the day my daughter has a baby. Okay.
Oh, what's her due date?
Not till the 28th, 27th. You never know. Okay. What else is up in the department, Meredith?
Well, I was taking your lead from the conversation that we had on Monday or Tuesday of this week, thinking about what you and the board would like to be updated on. So one of them was our City of Northampton emergency planning, what we're doing around emergency planning. And I want to let you know that in January of this year, we partnered with the Director of Medical Operations at Smith College Shat Center to prepare for a potential measles outbreak at Smith College. Participants included Smith College medical staff, their security team, their admin team, their IT facilities. Cooley Dickinson Hospital was at the table, of course, and myself and our emergency preparedness director, Lauren Davin. We formed and strengthened partnerships with our key stakeholders. In addition, we updated our contact information, making sure that we all had each other's cell phone numbers because we know how important that is. When it comes to a disease outbreak, we discussed the risks and the protocols related to measles outbreak and considered various different scenarios and challenges that could arise. So that was an amazing tabletop exercise that we had in January. In May of 2026, we're having a mass evacuation tabletop, which I'll make sure that you're invited to. This is an in-person tabletop. It will not be hybrid, and it's going to take place, I believe I've scheduled it for the Senior Center in Northampton. I don't have the exact date, but we're going to have our local leaders. So it's going to be interdepartmental for the city of Northampton. Many of our departments are going to be there, emergency responders, community partners. We're going to come we're going to come together to discuss how we would respond if a large number of people needed to leave the area quickly due to fire, power outage, equipment malfunction, or threat, or any other emergency. We're going to reestablish relationships with our key stakeholders to ensure that we know how to get in touch with each other, what their roles and responsibilities are if this were to happen. We'll discuss how to get people to safety, where would they go, how to share clear, concise, uniform information to the public, and how the different groups would work together. The exercise will help everyone better understand what their roles are, contact information, identify resources, identify any gaps, which I'm sure there are. And we're going to have a guest speaker come whose name is Chief Brian Nardelli, from Brockton Fire. And he's going to discuss his recent mass evacuation that he had in Brockton, which was a 10-alarm electrical fire at the Brockton Hospital in 2023. And he said he has had mass evacuation tabletops and thought that he had identified the gaps, the resources, the network. But in a practical sense, having gone through this, there were so many lessons learned and takeaways that he wants to share this with other communities, especially communities that do have hospitals in their town. So that's super exciting. More to come. We also have a sheltering exercise coming up. A regional shelter exercise is going to be held at Smith Voc Agricultural School in partnership with the American Red Cross, and that's going to be in June 2026. This will bring together our local emergency management team, public health, our volunteer agencies, to practice a large-scale emergency shelter opening. If you remember, they are identified as our Tier 1 regional shelter. We have not exercised this since before COVID. So we're going to do that in June, and I'll let you know the date. And then the other priority emergency preparedness work that we're doing is the DHHS has proposed to participate in, it's called Spanning Boundaries. It's a collaborative climate resilience initiative between unhoused people and geoscientists in Massachusetts. This project proposes that we'll work collaboratively with UMass Boston and geoscientists to develop an emergency flood communication plan, establish a local alert system, and develop local flood thresholds, and use the insights to integrate findings into existing emergency plans. So Lauren is actually meeting with dispatch next week to talk about our code red system and what that could look like. And So that's really exciting. And I think honestly, there's when I look at a lot of the grant funding out there, it is all about climate change and public health, the impacts on public health. So that's what's happening in the emergency preparedness world. Also want to let you know that we were recently awarded, I think yesterday or day before, through Health Resources in Action, also known as HIRA, a $10,000 grant for Policy Systems Environment Prevention Project. Did I say that right? PSE, Policy Systems and Environment grant funded. I don't know. Yeah, I can't think of it. But anyways, whatever. Kara McLaughlin, who runs our new Chapter 84, our youth equity collaborative, applied for this funding and was awarded the funding. And maybe Taylor can speak to a little bit better than I can because I'm a little lost on this one.
It's okay. This is all good. Yeah, so the Youth for Equity in Action, which is the group of young adults at Northampton High School who work with Kara and other partners across the county and the city, applied. And what the grant entails is helping to pay for stipends for students and adults who partner for restorative practices. And in regards to relating to the 84 project or the 84 chapter, they are going to be doing some campaigning and education for young people around how big tobacco has historically targeted certain populations. So young people of color, trans and LGBTQIA students, those who have higher rates of nicotine use, to talk about and educate young people with a racial and social justice lens, which, hopefully will empower students to make healthy choices. And this will go in tandem with the restorative practices work they do. So the Nothing About Us Without Us photo voice projects that they've done, having young people talk about health in their own words. This project is going to kind of help to sustain and grow that work that's already been happening, but really with the focus on that big tobacco and social and racial justice lens.
Thank you, Taylor. I should have taken some notes on that.
That's
I was
okay.
stumbling. And in addition to, just to dovetail on that, Kara and 3 of her youth actually attended Enough yesterday. Enough is the Chapter 84 Movement's Youth Day of Action. It's a national day of education and advocacy around tobacco, vape, and nicotine prevention. Used to be National Smoke Out Day, National Kick Butt Day, and now it's called Enough Day. And it was, I asked Kara to tell me how the day felt to her because I've gone several times and I always come back really kind of recharged and ready to do more work around tobacco. And she said she brought 3 kiddos, from one was a 12th grader and then 2 were 11th graders who were amazing advocates for the work and addressing health equity issues in their lives. And that, you know, that can lead to advocacy for positive changes. They met with, I think, Rep. Sabadosa, she told me, and Jared Freeman, and from Senator, and also someone from Senator Comerford's office. But anyways, long story short, this work brought them to the State House. What an amazing experience, both for the youth and Kara. It's about 90% youth participatory and 10% adults, and it's just such a real powerful day. So that's awesome. Taylor, I didn't expect you to stay on the meeting. If you just want to, we have a few minutes left because I know we have to leave at 7 after this update. I just wanted to let you know, I sent around Luke Messick's application. He put in his application in August for the Board of Health. And if everything goes according to plan, perhaps maybe April, May, he'll be in attendance at our May meeting. He was appointed on March 16th at the City Services Committee, and then he will appear on April 6th on the City Service agenda again, and then followed up by final vote at full council on April 16th. And then if that's approved, he will be sworn in by our city clerk, Pam, after that, and then he can join our first meeting. I was asked why the, length of time. When he put in his application in the end of August, I immediately responded to him because we've been without a fifth member for quite a while. Super excited to meet with him. And unfortunately, he was not going to be around the month of September because he was working with the Indian Health Service in Arizona. So we didn't get to meet until October. And then after we met, he actually attended our October Board of Health meeting, maybe even one after that as well, and came back to me and said, yeah, this is something that he'd really be interested in doing. So after that, the process was in the mayor's hand, in the mayor's office to move things forward. And I think maybe it just got stalled with the election. I'm not really sure what happened, but anyway, he is on his way to becoming hopefully our fifth member to round off our board. So I'm excited about that. Taylor, can I hand it over you to talk about the opioid recovery and remediation fund meeting that we had last week?
Happy to. Oh, I see a question.
Oh, Janet, go ahead. I can't hear you, Janet. I'm sorry, you're on mute.
Sorry. I
That's
just
okay.
want to make sure it gets in there before we close. I have on my calendar in a DHHS event on March 23rd. Is that not correct? It said PM and we'd hear more about it, but maybe
That's moved.
was that moved?
What was it?
It's the Academy of Music event that Michelle is working on.
Thank you. Yes, no, we have to postpone that.
Okay.
Okay.
Just so I know for my
Yeah,
calendar.
thank you. Actually, yeah, thank you. Taylor, go ahead.
Okay, I'll keep this short because it sounds like we should be wrapping up. Last Friday, we had the opportunity to host some MADPH, so Department of Public Health, and BSAS, which is the Bureau of Substance Addiction Services, colleagues and partners who are on the ORF team, which Meredith just mentioned is the Opioid Recovery and Remediation Fund. You have heard Lauren and I talk about the municipal level opioid settlement funds. This is the state's bucket of funds, which have also come from the lawsuits against pharmaceutical companies. They have been doing listening sessions across the state. So we pulled together partners from Hampshire County, where the team from DPH shared what they are looking to do with the funds, what they've done already. This is millions of dollars that the state has also through 2034, I think it is. But we had partners from DHHS, Tapestry, Northampton Recovery Center, Mana, A Positive Place, different municipal boards of health, Southampton, Amherst, Belchertown, Ware, coalition partners. So a really nice spread of providers, people who work directly, our sheltering and kind of housing navigating partners, and the municipal level folks come and share challenges that we see in Hampshire County, things that are great that we think should be elevated and highlighted, that we need funding to sustain and grow. I would direct, there was an article that just came out this afternoon in the Gazette where Meredith is quoted very well, but to sum it up, like the challenges that we're facing due to the cuts to federal funds are growing and it's becoming harder, and yet there's more work to do. And so how can we leverage our partnerships, but also potential state level funds to make sure we can meet people and what their needs are. So I think I look forward to maybe sharing more and more detail, though the state is going to prepare a report on common themes that came up from each region and then across the Commonwealth. But it was a last minute event that had a really positive turnout, and the officials were pretty impressed hearing about the collaboration that happens in Hampshire County.
Thanks, Taylor.
Mm-hmm.
Also, if we have just 2 more minutes, I want to mention that National Public Health Week begins April 6th. So April 6th through April 12th. The theme this year is Ready, Set, Action. Every year, our DHHS puts on a lot of community events during this week. So stay tuned. We're going to have a press release pretty soon about our calendar of events, what's happening. But there will be one larger event that we're going to host on April 7th, and it's going to be 5:30 to 7:30. And it's kind of a fun event. We're kind of still putting the particulars together, but I can tell you there'll be painting involved, there'll be pizza involved, and there'll be public health professionals involved. And really, we're asking the public to come in and giving them canvases and ask them to depict a picture of what they think public health is. And for us to put a collage together, we thought that'd be really fun and kind of highlight. And we're also going to be tabling our different divisions. So we'll be highlighting the work that we do that way. But more to come on that. Our DCC had a donation drive, probably January and February. Just want to let you know that they collected over just about 1,300 pounds of clothing and warm weather gear and donated it to our community partners that do the distribution of that. And they keep a little down in the DCC as well in case someone were to need it who comes in receiving services. And then I think lastly, because I know Joanne wanted a hard stop at 7, I just want to let you know about an hour before the meeting, I sent you all an email. Joanne had mentioned to me that at the MHB, they talked about battery energy storage systems, more large scale battery systems. And she just wanted me to ask some information to our City of Northampton folks, like, do we have these? If they don't, are there any regulations or siting restrictions around them? So what I did was I copy and pasted the email chains that I received and sent out to Chief Pelis, who is NFD fire chief, also to Carolyn Mish, who is our planning director. So you have that information. And I also attached the PowerPoint presentation that Mike Hugo did at the MHB conference. I think everyone was there except Janet I don't think Janet, you were there on Saturday, correct? But I just wanted you to be up to date with the information that we were receiving. So we're way over time by 7 minutes. Mm-hmm.
Okay, but we still have to do minutes. But you were going to say a little something about, we had some concerns about the cannabis consumption sites.
Right. So I really don't have an update for you, with the exception that there is no one clamoring at the mayor's door to open up a cannabis consumption site. In fact, Alan Wolf had told me that he was talking to a couple recreational vendors, just wondering what's the feeling around town? And they're like, no one thinks it's really a good economic business model. Like, it's not going to be a successful business. So it was interesting to hear that, but I'll keep you posted and updated if I hear anything different. It doesn't mean that we shouldn't start thinking about possible regulations or restrictions or maybe advocacy in case this does happen fast. The word on the street also is it will be at least a year before the state is ready to give out their first permit. So we do have time to think about it. If we are going to have these types of establishments in the city of Northampton, what types of restrictions would we like to see in place?
Great. Thank you so much.
Mm-hmm.
Let me see if there's anything else. One other thing that Meredith and I talked about was whether we wanted to have 1 or 2 meetings a year in person. Is there an interest in that? We could sort of plan ahead on times we think everyone would be available in person. Does that sound of interest?
I wouldn't be opposed except for in the dead of winter.
We'll make sure it's good weather. Yeah.
My only concern is that makes it more difficult for the public to participate if we don't have a virtual meeting.
I think there are some people who'd prefer to come in person. I don't know, but I just thought it'd be nice for us to see each other in person, and although I think Zoom meetings are most convenient for most people, but I just thought that might be a nice thing. Let's see. I think that's good. Shall we look at minutes? Did everyone get minutes that were edited by me? They have some red marks on them. Any questions or comments about those minutes? Those were from January.
I just have a couple trivial things. I think it's fine. I don't think I got the one with, mine doesn't have any red.
Oh, you don't have any red marks? You want me to show it?
But no, that's
Yeah.
okay.
I didn't get red marks either, actually.
You didn't
but
get
that's
the
okay.
updated version? I just
It was sent. It was
I just
sent.
clarified the language a little bit. Hold on.
Yeah, you had to change the view of the document to get the red
Okay.
marks.
There was nothing of real significance. It was just a little clarifying language. Let's see.
Can I just have one quick question? Under, let me see, you flipped. It was the paragraph, the second paragraph under old business. There are currently 21 communities is how it starts. A little bit further, I think.
Right here. Yep.
Are these bylaws? Are these laws? Are these regulations in line 4?
I mean, I was under the impression that different communities depends on their governance system, that it could be any of those things depending on how their government works.
I think that's true.
I don't know what the overall term is for that, though.
Where are you looking? I'm lost. I'm
Word
sorry.
bylaws. You concerned about this word bylaws? Yeah.
Oh, okay.
And if you want to change that to regulations, more broad?
Well, that's what we do. I don't know what bylaws are, but perhaps that's what others do.
Well, I guess I think of regulations as encompassing all kinds of rules.
Okay.
Yeah.
Kelly, you want to make that change?
Yes.
Okay. Just change that here. Regulations.
Oh, I have one more thing. Could spiffy please be spelled out under?
Where is
spiffy? Is
I was wondering if someone was going to ask me to do that, or at least make it in capital.
It's under the Heather paragraph right there, I think. In middle of that paragraph, there it is.
Yeah.
1,
Spiffy?
2, 3. Yes, that one.
And who can tell me what it stands for?
I don't know. We got some information about it, but I don't have it handy.
Okay, maybe Kelly, you can figure out what that stands for and put that in there.
Okay.
Gonna ask Heather.
Oh, I have it. I have
Fees
it.
for prevention?
Strategic Planning Initiative for Families and Youth Coalition. So Strategic Planning Initiative for Families and Youth.
Initiative for families and youth. Okay.
Yep.
All right. Anything else about minutes? Would someone like to make a motion?
I move to approve as amended.
Second.
Second, thank you. Any discussion? All in favor? Suzanne?
Yes.
Cynthia?
Yes.
Janet?
Well, I'll abstain because I wasn't at the meeting, but I
Okay.
think you should write the word coalition after spiffy too,
Okay.
if you want to be, because that's, yeah.
Correct.
Yeah.
Joanne, yes. So that's about the minutes. Thank you, everyone. And would someone like to make a motion to close the meeting?
I'll make a motion to close the meeting.
Second.
Is there a second? Thank you. Just want to again say our next meeting is April 16th. And please let me know if you cannot attend. Any discussion about closing the meeting? All in favor? Suzanne?
Yes.
Cynthia?
Yes.
Janet?
Yes.
Joanne? Yes. Thank you all.
Thank you. Have a good night.
Thank you. I'll be in touch. Thanks. Bye.